If sympathetic nervous system and the RAS system are activating time and again, they're actually increasing the heart rate, they're increasing the contraction of the heart, they're increasing the afterload, they're increasing the preload. In a nutshell, we can say that they are increasing the stress on the heart. So due to which what will happen? The shape of the heart may change. We call that as cardiac remodeling. In order to avoid cardiac remodeling, we'll apply the following pharmacology through which we will help the patient to maintain the normal function of the heart. Like this will decrease the activity of the heart. The very first class, angiotensin converting enzyme inhibitors, like captopril, enalapril, means they're having the pril in the last. So these drugs are actually blocking the angiotensin converting enzyme. If we block this enzyme, what is going to happen? The angiotensin 2 will not be produced. And if they are not produced, so their action on the adrenal gland, on the antidiuretic hormone, and on the arterioles is decreased. They were responsible to increase the blood volume. Aldosterone, antidiuretic hormone, they are supposed to reabsorb the water and salt into the blood vessel. What will happen in the blood vessels? The concentration of the fluid will increase. You can say the blood volume will increase, and due to which what will happen? There will be increase of the venous return. When we block angiotensin converting enzymes, they will not produce angiotensin 2, and there will be no production of the aldosterone, and there will be no production of the antidiuretic hormone. You can say that then there will be no increment in the blood volume. So blood volume will be reduced. As the blood volume gets reduced, there will be reduce of the venous return, or you can say there will be reduce of the preload. Like this, what will happen? The ACE inhibitors will actually help in reducing the stress on the heart. And we have another class that is called as ARBs, angiotensin receptor blockers. Their mechanism of action is just like of the angiotensin converting enzyme, but they are specific on the receptors of the angiotensin. Now, angiotensin is responsible to activate the adrenal gland to release the aldosterone. Now, here the receptors are available for this angiotensin 2, and we have on the antidiuretic hormone also, and we have here also the receptors for the angiotensin 2. So, what will we do now? If the patient is complaining of the dry cough and of the edema, then we will give that patient these medications in order to replace the ACE with the ARBs, in order to avoid the side effects of the ACE. So what will these do? They will actually target the receptors, and rest of the mechanism is the same. Means they will decrease the venous return, they will decrease the preload. Like this, stress will be reduced on the heart. And example of the drugs are valsartan, telmisartan, olbisartan, etc. Means sartan actually mention the ARBs. And we have the next class that is of the aldosterone antagonist, like spironolactone, eplerenone. Aldosterone antagonists will act on the aldosterone receptors. And you know that they were responsible to do the reabsorption of the water, and somehow they are actually helping us in the potassium maintenance level also. Well, we'll come to the point that, to this specific point, that aldosterone antagonists are actually helping us to reduce again the venous return, and they will also again, if the venous return is decreased, you can say that the preload is decreased on the heart. When the preload is decreased on the heart, so you can say that that stress is a bit decreased. We're actually decreasing the stress on the heart. We have another drug that is called the beta blockers, like carvedilol, metoprolol, and etc. These medications are doing actually, they're blocking the beta receptors on the heart. We have on the SAN, we have on the ventricles. So when the SAN and ventricles receptors are blocked, like this, the heart rate will be decreased due to the SAN receptor blockage, and the receptors of the myocardial cells, contractile cells, when they are blocked, then the contraction of the heart will be reduced. So by means of beta blockers, we are actually decreasing the heart rate, decreasing the contraction. Like this, you can say we are decreasing the stress on the heart. So in a sense, we also need somehow a little bit contraction also. But for that, we will go for the inotropic drugs. These drugs like digoxin, they will help us in doing the proper contraction. So digoxin are actually increasing the strength of the heart, not the heart rate. We have discussed the digoxin's mechanism of action in a very detailed way. By the way, so these drugs are used in order to maintain the contraction, the proper contraction. So beta blockers are actually decreasing, and digoxin is actually increasing just the contraction, not the heart rate. So we need a proper contraction to pump the blood outside. So like this, the beta blockers are also helping us to reduce the pressure or the stress on the heart. And we have the next one that is called diuretics. You can imagine from the name, dia means to increase or to go through, diuretics means urination. They are actually increasing the urination. Like this, the blood volume will be decreased. When the blood volume is decreased, they are actually decreasing the venous return, and they are also decreasing the preload on the heart. And like this, the stress on the heart is a bit maintained. By the way, these diuretics are actually indicated to those patients, those who have edema, either peripheral or pulmonary edema. Like this, they will bring those tissue fluids to the blood vessels, and like this, these fluid will be then moved out through the urination process, and the blood volume will decrease, and those edemic conditions may become normal. And we have the next one that is called is the direct vasodilators. We have vessels like arteries and veins. So they will also dilate the blood vessels. If we dilate the arteries, for that we have the drug hydralazine, and for the veins we have the drug nitrates. So by dilating the arteries, we are actually decreasing the blood pressure, and we are decreasing the outer load. And by dilating the veins, we are decreasing the venous return to the heart, or you can say we are decreasing the preload. So when we decrease the preload and afterload on the heart, like this, we are actually decreasing the stress on the heart. So what we mean is that we are supposed to decrease the stress on the heart, or to bring the heart into a normal state. So like this, these medications are helping us to decrease the stress on the heart, and the work on the heart will be decreased. As the work on the heart decreases, then those chances of cardiac remodeling may decrease. So this is the pharmacology that is helping us to reduce the cardiac failure. Hope so you got. If still you have any kind of question, you can drop that in the comment box. We'll come for the answers very soon. Thank you for watching.